Do you ever feel more like a life insurance salesman than a dentist? Well, what do I mean by that? Life insurance salesmen look at their customers or their clients as annuities, getting paid on their policy year after year, especially with the whole life policy. As dentists, a lot of us look at our patients as annuities. We go into the hygiene room, we check the patient, but really, are we checking the patient or are we looking for something to do to fill our schedule? In our practice, if I find something that needs treatment in the hygiene room, it doesn't make me feel good. It makes me feel bad. It makes me feel maybe I wasn't doing my job or the patient wasn't following my instructions. When a new patient comes into our office, at their initial visit, I will give them a report of findings. We'll do our examination and we'll give them a diagnosis and I'll give them some treatment options. And then I tell them something. And I do this to every new patient. I say, if I'm going to treat you, especially if you have periodontal disease or a chronic disease, my treatment won't work unless we are partners in care. What that means is that my patient must come back and get their teeth cleaned every 3 months if they have periodontal disease. They have to brush and floss at home. So what I do is something that somebody did to me once when they asked me to write an article. I said, okay, I'll write the article. And they said, no, do you commit to writing the article? It was actually P.D. Miller. And I said, yes, I'll write the article, Dr. Miller. He goes, no, I want you to say this. Dr. Miller, I commit to writing this article by this date. And I did. It was on a Sunday morning, and I said to Dr. Miller, I commit to writing this article by this date, and I wrote the article, and it's been published because of my commitment. So life works to the extent to which you keep your commitments. The people who keep their commitments are more successful. They have certain habits. Now, brushing your teeth every morning is a habit. Washing your face when you get up is a habit. Taking a shower every morning is a habit. Getting your teeth cleaned every 3 months for a patient that has periodontal disease is a habit. Now, most patients don't get their teeth cleaned every 3 months. Matter of fact, I have more patients in the basement of my office than I do in the clinical area. What I mean is not patients themselves, but their charts. I've been in practice close to 40 years. Now, if I've been in practice over 40 years and been treating thousands of patients, I should probably hire a new hygienist every 1 or 2 years in practice just to treat my recall. But yet I only have 2 hygienists there a day. In reality, if everything was going really well and I was doing my job and patients were following my advice, I would probably have about 25 hygienists working for me every day because that's how many patients should be in recall. Now, if a patient doesn't go on recall, where do they go? I have no idea. I doubt if they go to another periodontist. And every week we go into our basement because a patient comes back that hasn't been to the dentist in 15 years and I have to pull up their paper chart because we weren't digital about 10 years ago. So what's the point of all this? The point of all this is that I want to get my patients into a recall practice. I want to maintain my patients' health. When patients come to see me, most of them are broken. I'm a periodontist. They have severe periodontal disease. They have multiple missing teeth. They have caries. They've been neglectful. Most people come to see me not after years of never seeing a dentist, but seeing a dentist and then not seeing a dentist and then seeing a dentist and not seeing a dentist. They didn't have very good habits. So at my initial visit, once I complete my exam and I give them my report of findings and I tell them the treatment recommendations, I said, don't do any of this treatment unless you commit to getting your teeth cleaned every 3 months. And they go, yeah. I go, do you remember the commitment? And every one of them says the same thing. Yes, I remember the commitment. We laugh about it a little bit. We make it a joke. We keep it a little bit light and airy because people are more comfortable when they're at ease. But they also know that I'm committed to their health. So in our office, my goal is to get people healthy and to keep them healthy. I don't look at my patients as annuities. Yes, we make money in the hygiene room, but not much compared to when I'm doing surgery. The most money I make is when I'm taking out teeth, putting in bone, and putting in implants. And that's not the best treatment for patients, is it? It's really repairing damage that's been done. I'd rather prevent the damage from occurring. So, are you going to practice like a life insurance salesman or a comprehensive dentist that wants to prevent disease? And I'll tell you, your practice will be busier if you have a preventative-based practice. Now, we all give lip service to that in dental school. We say we're preventative-oriented, we fluoridated water, and we say we treat periodontal disease. But as you know from previous logs, only about 3% of the periodontal disease is being treated. Most of it is not being treated because it's not being diagnosed, because it's being neglected by dentists and patients. So we're all neglecting it. So don't be a life insurance salesman. Be a comprehensive dentist that does the best for their patients and gets them healthy and keeps them in a maintenance program. And remember, be the gift.